Welcome to Minutes to Fit. Our mission is to be a liaison and echo the words from the professionals and give you, our subscribers, some sort of insight. The information contained in this video is of general nature and does not constitute medical advice. Talk to your doctor for your individual circumstances. This will be a 3-part series on type 1, type 2, and gestational diabetes. At the end of my video on type 2 diabetes, I mentioned a product called black seed oil. This is what it looks like. There are great reviews on Amazon for this product. They're testifying that it helps diabetes, inflammation, and also autoimmune diseases. So we're going to put this thing to the test and see how it works. Stay tuned. Welcome to Minutes to Fit. I'm your host, Imani. Today's topic is type 2 diabetes. Type 2 diabetes is the most common of the three. It is also a disease that occurs when your blood glucose levels are too high. In type 2 diabetes, your body does not make enough insulin or does not use insulin well. Too much glucose stays in the blood and not enough reaches your cells. Exactly why this happens is unknown, although it's believed that genetics and environmental factors contribute to the cause. Symptoms of type 2 diabetes is slow healing sores, frequent infections, dark skin under the armpits and on the neck, increased hunger, thirst, and urination, blurred vision, unintended weight loss, and fatigue. Risk factors of type 2 diabetes. Being overweight is a main risk factor. If you store fat in your stomach area, that's a risk factor. If you're not very active, you're at greater risk. If your parent or sibling has it, it increases your risk. African Americans, Hispanics, Indians, and Asian Americans are more likely to develop type 2 diabetes than Caucasian people. Gestational diabetes. If you had a diabetes while you were pregnant or had a baby over 9 pounds, it increases your risk. PCOS is polycystic ovarian syndrome, which is irregular menstrual cycles, excess hair growth, and obesity, and that increases your risk. Dark skin under the arms and on the neck indicates insulin resistance. Prediabetes, if left untreated, will progress into type 2 diabetes. Diagnosis of type 2 diabetes. Random blood sugar. That is a test that takes your blood sample at any time regardless of the last meal. Your blood sugar above 200 milligrams per deciliter suggests diabetes. Fasting blood sugar is a blood test that's taken a blood sample after fasting overnight. Blood sugar less than 100 milligrams per deciliter is normal. A blood sugar level from 100 to 125 milligrams per deciliter is considered prediabetes. Hemoglobin A1C is a blood test that tests your blood to find out how your blood sugar has been running for the past 2 to 3 months. Type 2 diabetes complications. Type 2 diabetes can cause heart disease, stroke, high blood pressure, and narrowing of the blood vessels. Excess sugar can cause tingling, numbness, burning, or pain, usually at the tips of the fingers or toes. Damage to the nerves that control digestion can cause nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Diabetes can lead to kidney failure or irreversible end-stage renal disease, which may require dialysis or a kidney transplant. Diabetes increases the risk of eye diseases like cataract and glaucoma and may damage the blood vessels to the retina, leading to blindness. Cuts and blisters are often left untreated, and they can cause serious infections. Severe damage may require toe, foot, or leg amputation. Type 2 diabetes prevention. The choices that we make in life can help prevent from getting type 2 diabetes. And that's true even if it is running in your family. If you have pre-diabetes, lifestyle changes can slow or stop the progression of diabetes. Eat healthy foods like fruits, vegetables, and whole grains. Eat foods low in fat and high in fiber. Get active. Take a brisk walk, ride a bike, swim laps. Try to move around for a few minutes every 30 minutes. You can also split the activity up throughout the day. Lose weight. Lose 5 to 10% of your body weight can lower your risk of type 2 diabetes significantly. So if you're 200 pounds, you would need to lose 10 to 20 pounds. This has been your host, Imani. I want to share something with you, my subscribers. Both my husband and I were diagnosed with type 2 diabetes. I was obese. I have PCOS. I have all the risk factors against me. It runs in my family. Just about everything was against me. I lost the weight and I did get rid of mine. But my husband, he's very, very thin and he's having such a hard time with keeping his numbers in control. So you don't have to be fat to get it, is my point. We're going to try doing a plant-based diet. And we're also going to try this product called black seed oil that I hear highly reviews on it, and it helps with a lot of different ailments. So I'll keep you posted on how those things are going.